Thank you. We received a question from Peter. Digital health solutions are now often implemented in hospitals. Is there also a market for independent care providers? And if yes, how would you approach this?
Okay.
Ingrid?
Yeah, I can definitely answer that. I think also, like I mentioned in my presentation, it's not just a matter of health of pharmaceutical companies or medical device companies. Also, healthcare providers will have to compete on demonstrating better outcomes or making a better patient experience. So also for them, it's a way, in fact, to be more competitive, be more attractive for patients. And hence also to be a better in a better business shape. So that can be for hospitals to make the patient experience better organized, but also to support patients in collecting their data prior to the hospital visit, so that doctors can have their data available during a doctor visit. But also individual private practices can benefit of that in better coaching, supporting their patients, whether to prepare a meeting with a doctor or whether to further surveil patients in between doctor visits. Especially for home hospitalization players, this is a very interesting opportunity. It allows them also to organize and coordinate their care better and monitor their patients remotely on a much more intensive basis than they can ever do without technology.
Yeah, if I can add something, there's of course a big trend which is patient empowerment and the request from patients to know more about their conditions and to be able to follow them up. So that's one big trend. But the other big trend is also on continuity of care and outside of the hospital. So there was a seminar a few weeks ago from one of the large hospitals in Belgium, and they were talking about the future of medicine, which will happen a lot more outside of the hospital. And so they were wondering how they could establish partnerships with individual doctors, with home nurses, and all of those actors, first-line actors, sometimes they are called. So there is a better continuity of care around the patient. So that's another big trend that's also happening, which will probably have things move.
One of the things that's happened here in the States just in the last year is the ability for doctors to charge for remote patient monitoring with the new CPT code. So that's one way that the Medicare and Medicaid is encouraging doctors, first-line doctors and primary care doctors to adopt digital tools for monitoring.
Mm-hmm.